This is Mike Flowers. This is the first shoot in a series of patient education videos that I'm going to be doing. And today we're going to be talking about diabetic ketoacidosis. As I'm sure you're aware, there are in general two types of diabetes. We have type 1 diabetes, and in type 1 diabetes, those patients do not make insulin really at all. And then that is opposed to type 2 diabetes, and type 2 diabetics continue to make insulin, but their body is just resistant to it. But the important thing to remember is they do continue to make insulin. And there are different types of complications that you can develop between type 1 and type 2 diabetes. And diabetic ketoacidosis, which is our topic for today, that's a complication that you really only see in type 1 diabetes. In extreme circumstances, it can happen in type 2, but for the most part, it's going to be something you just see in type 1. In fact, a lot of times when people are initially diagnosed with type 1 diabetes, it's because they show up in the emergency room with diabetic ketoacidosis. You have a protein floating around in your blood called lipoprotein lipase. And what it does is it takes fats and converts them into ketones. A ketone is an alternate fuel source for the body. Your body can burn a ketone molecule just like it can burn a glucose molecule. So from an evolutionary standpoint, that's important because back in the caveman days, you might not be able to eat every day. So what that does is that allows you to eat when you can, and you store your excess energy as fats. And then while you're fasting and waiting on your next meal to come around, you can break those fats down into ketones, and that will keep you going until your next meal comes around. The problem is, a ketone is also an acid. So if you break too many fats down into too many ketones, you become acidotic, and that's bad. So what regulates this whole pathway is insulin. Insulin turns lipoprotein lipase off. So if you have insulin on board, lipoprotein lipase is not breaking fats down into ketones, and you do not have the acid production. So that's when I know when somebody comes into the emergency room and they're in diabetic ketoacidosis. As I mentioned earlier, this may be how we actually initially diagnose someone of type 1 diabetes, but if you're a known type 1 diabetic, and you come in DKA, that tells me you're not taking your insulin. Regardless of what you tell me, this just simply should not happen if you have insulin on board. Now, again, in extreme circumstances, it can potentially happen, but for the most part, if you come in DKA, you're not taking your insulin. Now, it's possible that you have a bad batch of insulin, or maybe your pump malfunction, but you're probably not taking your insulin, is the reality. So in that regard, that's why it's so important for type 1 diabetics in particular, you have to be compliant with your insulin regimen. And so, of course, there's lots of different insulins out there, and we'll talk more about that in some other videos. But long-acting insulins and basal insulins is what's going to keep this from happening. So again, you just in order to prevent DKA from happening, you have to take your insulin. Treatment of diabetic ketoacidosis is sometimes difficult for people to understand. A lot of people and even some physicians think that you're treating the blood sugar. You are not treating the blood sugar when you're treating ketoacidosis. What you're treating is the acidosis. And the really interesting thing is that sometimes a patient in florid DKA may not even be hyperglycemic. I can remember very early in my career, probably the sickest patient that I've ever taken care of his blood sugar was actually low. And so in order to adequately treat him, I had to get his blood sugar up. So just remember, usually the blood sugar is elevated, but not necessarily. And so the way you treat diabetic ketoacidosis, as you will recall from our discussion a few moments ago, is insulin. We have to treat aggressively with insulin in order to turn off lipoprotein lipase. And so we need the blood sugar to stay up in order to do that. And so at some point when we're treating the condition, we'll change our fluids from something like normal saline to something that contains sugar. And again, that's so that we can keep the blood sugar high enough that we can continue to be very aggressive with our insulin administration. So again, just remember, you're treating the acidosis, not the blood sugar. And the thing you just have to remember for diabetic ketoacidosis, it's something you want to prevent. And so the way to prevent it is to not let it happen in the first place. And so I know I'm repeating myself, but you must take your insulin.